Well, when it comes to COVID-19, a tiny over-the-counter device may potentially save your life. Alan Martin joins us now with more on that. Alan?
It can. The new go-to gadget is called the pulse oximeter. Now, some health experts believe during this pandemic, you should have one by your side. COVID-19 can result in severe illness, organ failure, and death. The sickest of patients develop acute respiratory distress syndrome, a type of respiratory failure characterized by widespread inflammation in the lungs. But with this virus, the syndrome is strange.
Patients can have very, very low oxygen amounts, and yet they kind of still look comfortable.
Emergency room doctors are reporting how some patients are apparently walking around with pneumonia for days, getting sicker and sicker without developing any symptoms.
Almost unimaginable how people could be awake and alert and have oxygen levels that are half normal. Shortness of breath is a late sign.
That's why this device may help. It's called a pulse oximeter. Clip it on your finger and it measures the oxygen in your blood.
You know, normally we are 94 to 100% on these devices, these pulse oximeters. And people were showing up with oxygen levels of 50%.
And so you may not feel short of breath, but you look at the number and say, wow, I'm not getting enough oxygen. Call your doctor.
Dr. John Schwartzberg of UC is an infectious disease expert. He says with this device, doctors may get a patient hospitalized earlier, and that could potentially save lives.
Earlier identification of people who are going to be in trouble is that we can grab them before they fall off the cliff.
Well, the problem is the devices are a little like toilet paper was. They've become very hard to find. The prices have jumped if you can find one. You also need to know the home device is not quite as accurate as the one you would find in the hospital. Also, operator error is a problem. You might not clip it on correctly, and ladies, fingernail polish could skew those results.